Metformin is the most commonly prescribed medication for treatment of diabetes in the world. Yet, it is the most controversial drug used for diabetes as well. And newly diagnosed type 2 diabetic patients, particularly those overweight patients or patients who fail to comply with the lifestyle changes and so forth, and they need to control their blood sugar levels, right? Well, they're typically prescribed metformin. That's pretty much the gold standard. Even pre-diabetics or people with PCOS get metformin as the first agent. Why is that? Well, because it is super cheap, it is effective for those who can tolerate it. So why not, right? So most people end up using it. Some people, typically a minority of the people, love it. A majority, if not hate it, but they kind of learn to deal with the side effects or learn to live with it. It works with a cellular mechanism called AMP kinase activation, which is an enzyme that works as a partial signal switch, and it helps you improve your insulin resistance by making your own body break down glucose better and faster. As a result of that, your cholesterol also improves, and your LDL, the bad cholesterol, also improves. What else it does? It also improves the gastrointestinal flora, your bacteria in the gastrointestinal system, by increasing the good bacteria, and it helps to reduce the amount of carbohydrates that are absorbed or broken down by your body. Does metformin kill your kidneys? And I get this question a lot. It does not directly cause kidney damage. But what happens when you have a kidney failure? Now, most people cannot differentiate chicken from the egg, right? So is it the chicken or the egg? People's kidney function go down for many reasons, right? And if they're on metformin, which I would say 90% of diabetics are almost on metformin, most of the time, at least in the beginning, and then they blame metformin for causing the kidney damage. Well, that's not typically the case, but the reason we stop metformin when the kidney function goes below a certain level is because metformin is cleared by the kidneys. Like any drug that is cleared by the kidney, your doctor should adjust the dose or stop the medication depending on the kidney function, since it is clear from the kidney. Because in excessive doses, if metformin is not cleared by your body, there's something called lactic acidosis, which can actually kill you. Now, thankfully, it is very, very rare. That's why FDA said, you know what? It's so rare that we will allow metformin to be used by the patients until GFR is below 30. Kidney function, we call this GFR, glomerular filtration rate. Now, if you don't want to take metformin, you can take, berberine, superberberine, dihydroberberine. There's a lot of metformin equivalent, I would say, not necessarily pharmaceutically, but at least the efficacy-wise or the end result-wise is similar. And you don't necessarily have to use a supplement or a medication that works like metformin. You can use just something else that can get the job done, which is lowering your blood sugar, right? So we have a lot of supplements on our website. You can check that at sugarmds.com or sugarmds.com, which you may find useful. But back to metformin side effects, what are they? Of course, the most common one that everybody, I wouldn't say everybody, but a lot of people complain about is diarrhea, gastrointestinal side effects, stomach side effects. Some people may have gas, some people may have diarrhea, abdominal pain, all sorts of problems. Now, those are the common problems with metformin. What other things can you expect from metformin? Now, like any other drug, you can get an allergic reaction to metformin. You can develop a rash to metformin. Some people even get a chest pain from metformin. Now, chest pain is something that I don't really like, and it doesn't really happen common. I've heard a couple times in so many years of it happens, and we don't know why it happens, but I'm like, you got chest pain. I don't think that's a good idea to continue. Not that it has any heart problems associated with it, but if you are having a weird side effect, I would not just continue it. All right, guys, let's go over the side effects now. Now, metformin has a lot of side effects. Now, the most common side effects are gastrointestinal. Okay, so I'll go over that in detail, but if you want to summarize, let's start with the gastrointestinal side effects, which are stomach and intestinal side effects. So you may have diarrhea, you may have loose stools, you may have abdominal pain, bloating and gassiness, and all sorts of crazy side effects with metformin. The good thing is the side effects tend to disappear, and I'll tell you of how to remedy all these problems. One of the most forgotten side effects is B12 deficiency. Again, metformin may prevent the absorption of B12 in the intestinal system, and ironically, B12 deficiency can cause neuropathy, and diabetes can cause neuropathy, so you don't want to miss B12 deficiency, especially after a prolonged use of metformin. Now, what are the other side effects? Sometimes cardiovascular side effects, such as palpitations, chest pain can happen, flushing can happen, and we don't really like those side effects, especially if somebody is coming to me with palpitations or chest pain as a side effect. I'm like, maybe metformin is not for you. Respiratory side effects. Some people complain about shortness of breath. Now, general side effects. Some people will have like tiredness. Some people will be like weak, and they will have muscle pains, and that's, they may not know what's going on because they may not attribute those side effects to metformin, but it does happen. Dermatological side effects, such as skin manifestations. Sometimes skin eruptions can happen. Rash can happen with metformin. But these are typically the most common. Neurological side effects we can think of, like a dizziness or headaches can happen with metformin as well. So again, there's a lot of side effects. Now, most people do not take metformin correctly, and the reason for that is, like, doctor prescribe, let's say 1,000 milligram twice a day regular metformin. Oh my God, that's like worse than a suicide. 100%. If you prescribe 1,000 milligram metformin twice a day, 100% you will get diarrhea. The very rare people will not have diarrhea. So the way to start is starting very small, like 500 milligram. And then another important thing is to start with your dinner, and always take it with meal. If you take it empty stomach, you're gonna be in trouble. So take it with meal, start with dinner, take it for a week and see how it goes. And if everything is good, you don't feel bad, no side effects, then maybe you can start 500 milligram twice a day. And again, with meals, and maybe you can start with the breakfast and dinner this time. Another important thing that's forgotten all the time, yes, I know metformin is free at Publix in the United States, but that doesn't mean that free is good for you all the time, right? So extended release formulation has 4 times less side effects. So when it comes to diarrhea and bloating and all that, metformin extended release, which is metformin ER or XR, whatever your pharmacist has much, much less gastrointestinal side effects than a regular metformin. So if you think that you want to be on metformin, you want to stay on metformin, start with extended release. Again, to summarize, guys, start slow, start with meals, start with dinner once a day only, and then advance to twice a day, maybe 500 milligram twice a day, and then advance to maybe 1,000 milligram twice a day.
I'll see you in the next video. Remember to like, subscribe, and share. See you guys later.
Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.